Hi, I'm Therese Swenson. I'm here at the Southern Oregon University's Digital Media Center, and I just wanted to take a minute. This is the end of February, leap year. I just want to make a note about the current news about the coronavirus, which it really is a wake-up call for all of us to be very careful about cleaning our hands and taking the time to do it properly and get the soap and take 20 seconds. And if you see anybody coughing or sneezing, remind them to cough into their sneeze. And just know the facts, that if somebody's sneezing, you want to step back and be 4 or 5 feet from them. And the other thing is, what we're all learning is that this virus can live on an inanimate object. That means if somebody just rubbed their nose and they have the virus and they touch a door that you're going to walk through, within a few hours or a day, that virus may still be there. And so the most important part is for us to realize how we get this virus. I don't want everybody to be afraid, but it's really important for all of us to be educated. I think Southern Oregon is very aware, but if this PSA should be viewed by anybody, I want to remind you that we are living on an I-5 corridor where somebody can leave, for example, Travis Air Force Base and drive north through Oregon, and that's 4 or 5 hours. And they could leave that virus unknowingly on a keypad or a point of sale where you're buying something. And the most important part about this is for us to wash our hands and wash our hands and wash our hands. You may wish to consider antibacterial wipes, but the problem with those is they don't disintegrate. So it's important to just be wary to not touch your eyes and rub your nose if you're going in and out of public places. Please be conscious. I don't want everybody to be afraid, but in terms of community building, I have this little slide that I made of my community building. I'm making community building tiles. And my idea about community building is we all need to talk to our neighbors, and we need to share information if people are sick, and we need to be able to look in after people and help each other. Also, it was suggested that if you take medications, it's important to think about maybe 2 weeks before you're out. Don't wait until you're out of meds, because as some companies maybe have a sick person or something, there may be a chance that there's a delay in getting a refill or something. So I want to be sure with the things that are happening in other countries, they may make our medicines. So be sure that you have enough medicine if you depend on your medicines for a 1 week or a 2 week delay. Anyway, I'm here at the Digital Media Center for Rogue Valley Television, and I just wanted to do a public service announcement to don't be afraid, but be informed. It's very important to get your information from more than one source because it's changing every day. Out of 450 tests, we had 60 positives. But now they're getting the testing out across the country, so we will be finding where the pockets are that are transmitting this. Children are one of the biggest ways that viruses and flus and bugs get transferred by kids because they touch everything and put it in their mouth. So we might have some schools that'll close if a child gets a sniffle or a cough. They may not have the coronavirus, but to prevent the spread, you may find the schools are closing. And the reason I said community building, we may need to get together with our neighbors to provide childcare or to share if they're doing homeschooling. So just think about that in the back of your mind. If they do shut down schools for a week or two for kids to not spread the virus, you might want to work within a community and share maybe phone links and things. They're now doing neighborhood building. But I just wanted to remind people to be safe and think about the things that you touch, maybe wearing gloves going through doors. They say we shouldn't be wearing the mask if we're healthy. I want to stress that. It's the people that are sick that have the virus should be wearing the mask. It's the health workers that are working with the people that are sick should be wearing the mask. And the reason they say we shouldn't all rush out and buy masks is the most common thing people do is they put the mask on, they feel safe, and then they reach up and rub their nose under it, or they take it on and off with dirty hands. So it's most important for the people that are sick to have the mask, and not for all of us to run out and stock up on masks. So I'm not sure if that helps. I just wanted to mention a little something This is 229 leap year, and the coronavirus is now on my continent. Thank you very much, Therese Swenson at the Rogue Valley Studio for rvtv.sou.edu. Thank you.